I'll do like a 2 minute, you know, welcome everybody and then turn it over. Right. Welcome, welcome. Good to see you all. Just kind of taking care of some of these AI note takers. We'll let actual people inside. Um, let's see. Right. If you want to join us on video, please do. Lovely to see. It would be lovely to see people today. It is a lunch and learn, so if you're eating and you don't want to be on camera, I totally understand that too. But if you want to join us on camera, please do so. Hey Tom, good to see you. Summer's here from New Jersey. Awesome. It's great. We got some good folks on here. Thomas from Florida. Welcome everybody. Good to see you. All right. We're gonna get started. Honesty from Virginia. Good to see you. We're still letting some folks in, so just give me a minute to make sure that everybody's audio is hooked up and able to hear us. I already ate my lunch today. I got that in early. Great. Thank you for being here. It's good to see you. I know we usually have our virtual workshops the last Thursday of every month. But this month, I don't really remember the reason why, but we decided to do a lunch and learn so people can kind of check in during the day. It's good to see you. My name's Aaron Kacharski. If you don't know me, I'm the grassroots coordinator for Mobilized Recovery. Um, and each month we kind of pick a topic that's impacting our community. We really focus on thinking and acting locally for issues that are impacting people in recovery or people struggling with substance use disorder or the unhoused population, mental health population. I've been in recovery since September 6th of 2003. And so it's good to see you all. I always like when we can kind of check in and see each other's faces. Um, we have an amazing uh, workshop today, Lunch and Learn, where we're going to kind of hear some from the experts on an executive order that was signed in the middle of summer that really does, impacts the population that a lot of us, people that we care about, whether you're working with people with health or housing insecurities. Um, where you are. And sorry if I'm looking to the right, I'm using two screens here, so I am talking to you. But I have to look to the side sometimes. And I'm also letting people in. So I appreciate you showing up today. I know that we're going to have our experts kind of talk for a little while back and forth and then open things up to people's individual questions. And so you can put some of those questions kind of in the chat, but we'd love for people to like virtually raise their hand. And so I can take you off of mute and kind of get you in the queue for asking your question. And so we want to try to fit in as many questions as possible. And so try to keep your actual question brief. And so that way we can get a lot of participation from people. And so we have two amazing um, experts today on what's happening with the executive order. And I know sometimes, you're used to us working on things like thinking and acting locally, and then sometimes these things happen federally. And what does it mean for us in our own communities? And so we wanted to invite two amazing people. I've had a chance to chat with them in the last couple days. And so Libby Jones is the associate vice president of the Overdose Prevention Initiative, and she leads that initiative's advocacy efforts and advances federal policies that reduce the overdose death rate in the United States. And so obviously somebody that makes sense to have during this conversation. So thank you, Libby. And then also we have Jennifer Mathis, who is from the Bazelon Center for Mental Health Law. She's been there since 1999. It's done and has a long history of civil rights work and working with employee rights and people with developmental disabilities. And so we really have some amazing experts here today. And so with that, I'm going to turn things over to both Libby, and Jennifer.
Thanks, Aaron, and thank you so much for joining. I'm honored to be part of everyone's lunch today. Um, as Aaron said, my name is Libby Jones. I lead a program called the Overdose Prevention Initiative at the Global Health Advocacy Incubator. We are a DC-based nonprofit that works on federal policies, and so we work every day with Congress and folks in the administration. On policies that will address the overdose epidemic in the US. So I'm going to get us kicked off. Um, I just want to kind of give a kind of a high level overview of the executive order, kind of what it is, and probably more importantly, what it isn't. And then Jennifer is going to help give a little bit more detail and kind of the legal context of what some of these provisions mean. So, as Aaron said, July 24th of this year, which was a Friday, um, the Trump administration dropped on a Friday afternoon an executive order which they titled Ending Crime and Disorder in America's Streets. So, this executive order was framed as addressing what they called public order issues. It directed federal agencies to prioritize grant funding for states and municipalities to enforce laws essentially against public consumption of illicit drugs. So this executive order kind of hit a number of topics. The first kind of bucket is for HUD and HHS in terms of housing. So the executive order um, ad addressed limits to federal support for housing first approaches. It also put conditions on housing assistance on behavioral health in terms of behavioral health treatment. The executive order also stated a priority for supporting jurisdictions to enforce public safety laws around urban camping, open air drug use, etc. Um, it encourages the expansion of involuntary civil commitment, and it restricts harm reduction. But let's talk about first, before we kind of get into the weeds of this, and let's talk about kind of what is an executive order. So an executive order is not law. Laws are made by Congress and laws can be enforced. An executive order is issued by the president. Um, it does not have the force of law. And what it is it's a directive to federal agencies. It can easily be overturned by future presidents or by the court. And really, it's temporary because it doesn't have the force of law. So while, this July 24th executive order contains so many things that are potentially very harmful, I want to first put it in context that this executive order does not give the federal government any additional authorities. It does not give the feds carte blanche to start rounding up people with substance use disorder or mental health conditions. Also, it is not a mandate for mass incarceration. Um, what it is, and what any executive order really is a messaging document. This is on brand for the Trump administration. It is part of their rhetoric that is kind of this tough on crime messaging that they're putting out. But I think where I have the biggest concern around this executive order is that it does provide an opportunity for states and municipalities who potentially want to curry favor with the president, um, a justification for taking action at the state and local level. The, the biggest lever that the president is going to have is around discretionary funding. So that's grants, right? And so really that's what the there is no enforcement of this executive order, but how they can make it happen is through grants. Congress has the power of the purse. Congress and only Congress can determine how much money is being spent on different things. But the executive branch, under the president's leadership, will determine how that money is spent and who will receive that money through the grants process. So the president controls the executive branch, and through the competitive discretionary grant process, they will have discretion over who gets those funds and what strings are attached to that fund. So one kind of example from history that I like to pull from is actually President Nixon. So President Nixon wanted to put in national speed limits across the country, but he couldn't put in a national speed limit by law because we have this pesky little problem called federalism, right? The states are in control of the laws in their states. So what did Nixon do? Nixon put federal Department of Transportation money and made it conditional on states adopting a 55 mile per hour speed limit. So again, the Nixon didn't pass a law that says you state must do this or else you will be punished. What they did was they they had a series of executive orders and eventually passed a law that says um, states, if you want Department of Transportation highway funds, then it's conditional on this speed limit. So that is kind of, I think that's just an example of how, again, the president does not have the authority to make states do this, but they do control this pot of money. And that's how, in kind of carrots and sticks, they get states and municipalities to comply. And what we've already seen coming out of this executive order is communication from some of these agencies to say that they are going to look at this executive order as they are pulling together their grant funding moving forward. So HUD has issued guidance. White House ONDCP has stated they're going to recompete the Drug-Free Communities Act funding, to align with these priorities. And then I think it was a day or two after the executive order was issued, SAMHSA published what they called a Dear Colleague letter. And so this Dear Colleague letter is a statement of what, based on the executive order, what harm reduction services their grants could be used for. And I will say this, my read of that, and I will also defer to Jennifer, who will have her own read on it, but this Dear Colleague letter uh, just reiterates what we already know. There is nothing new in that Dear Colleague letter. The harm reduction uh, interventions that are disallowed in the SAMHSA Dear Colleague letter, such as like purchase of syringes for syringe service programs, are already in federal law. So they're just reiterating what's there. Nothing is new coming out of that executive order. So that's kind of my take on it. And now I'm going to pass it over to Jennifer, who can get a little bit more into the weeds.
Sure. Thank you, Libby. Um, as Erin said, I am at the Bazelon Center for Mental Health Law, the deputy director, and we are a national organization, also based in DC. Um, we do both litigation as well as policy advocacy. We have been around for about 50 years and primarily represent people with mental health disabilities. Um, Obviously, the executive order was of significant concern to us and many folks across the mental health community. I would just say at the outset that the premise that it was based on, that the folks who are committing most of the crime are people with psychiatric disabilities or SUD, is wrong. I was talking to one of the state mental health commissioners yesterday who opened up that way. And certainly, many state mental health commissioners are feeling pretty upset about this and sort of question the basic premise of it because it's not consistent with the facts. Um, but that said, I think I very much agree with Libby. This is it's a lot about messaging. I mean, it will influence policy, and that's what executive orders do. Obviously, can't change the law, create new obligations or new restrictions, but can nudge agencies in the direction of doing certain things. And I think some of that can be pretty damaging. But I think it's important not to overread what is in the executive order also. And there are a lot of caveats. There's language at the beginning of it. It's pretty inflammatory and just pretty awful about focusing on long-term institutionalization, um, beginning with paragraphs about vagrancy, disorderly behavior, and violent attacks are making our cities unsafe, and um, saying the overwhelming majority of unhoused people have substance use or mental health condition, and saying that we need to restore public order by shifting people from the streets to long-term institutionalization for quote unquote humane treatment through the use of civil commitment. Um, at this point in time, in particular, where Congress has just gutted the Medicaid program and state disability service systems, mental health, SUD service systems are stretched in a way, or will be stretched in a way that like is kind of unprecedented. The idea that they're going to start long-term institutionalizing people, I think, is not realistic. So there is that. I think what I anticipate happening is actually, to the extent that this is implemented, it will create additional homelessness rather than solving any homelessness problems because it will take housing funds away from people who need them. Um, that all said, I just want to go through some of the highlights of some pieces that are in this EO and the things that may be less damaging, things that may be more damaging in the end. So the first set of things, the first set of obligations is to the Justice Department. And it says the Attorney General should seek reversal of judicial precedents and termination of consent decrees that impede what is now articulated as the U.S. policy of encouraging civil commitment for folks who are on the street and are a danger to themselves or others are unable to take care of themselves. I don't know that that's been a U.S. policy to encourage civil commitment before, but in any event, this piece, obviously, it is concerning. It is concerning to have the president directing the administration or the executive branch not to enforce existing law, but to seek opportunities to overturn existing law, which is, to say the least, unusual. But the thing is, I worked in the Justice Department Civil Rights Division during the last administration, and I don't think there are good, real opportunities for DOJ to actually get out of consent decrees involving civil commitment. They have a lot of obligation. They have a lot of consent decrees or settlement agreements and enforcement actions around the right to community integration under the Americans with Disabilities Act, to have people with disabilities live in the most integrated setting appropriate. I think this executive order has been often misinterpreted or overread to mean that DOJ is supposed to stop enforcing the law, stop enforcing the ADA and the Olmstead decision in the Supreme Court. I do not think that's accurate, and that's not what this says. And nothing in that Supreme Court decision or in the ADA speaks to civil commitment authority. None of the DOJ's enforcement work limits the ability to civilly commit people. It's about creating the community services that folks need to live in the community. And so I think it is important. I mean, just as a messaging tool, it's important, I think, for people to identify concerns and to raise concerns about this executive order, but not to um, sort of be out there with messages that I think just reinforce ideas that this goes much further than it actually does, because I think that will just encourage agency actions that reflect that, and that we're best off raising the concerns, but raising them within the context that I think the executive order sets. Um, and so there are certainly caveats in a lot of the provisions in the executive order that say to the extent permitted by law, or things like that. So the ones about the Justice Department, I have heard some ideas about what may happen in new settlement agreements, which there are some things that could happen that are concerning, but I don't think that the Justice Department is poised to or in a position to seek to overturn um, judicial precedents about civil commitment, because they don't have those cases and they don't have the authorities to come in most of those cases. And so I think where it may show up is more just in new settlement agreements. There may be certain provisions that wouldn't have been there in a prior administration. Um, I think the things that are most concerning, as Libby said, are the provisions about the use of discretionary grants. It's important to note that it's only discretionary grants. It's not the formula grants like the block grants, the mental health block grant, the substance use block grant, the SOR. Can't remember what that stands for. But I think those things don't fall within discretionary grants. And for formula grants, you can't impose conditions. An agency can't just put new conditions on when Congress has said, this is how this money is going to be distributed according to this formula. The agency can't say, guess what, we're not giving you the money unless you have your civil commitment law look like this. They can do that perhaps with a discretionary grant, but not with a formula grant. Um, but so the provisions about discretionary grants say DOJ, HHS, HUD, Department of Transportation should use discretionary grants to prioritize jurisdictions that enforce prohibitions on open and illicit drug use, enforce prohibitions on urban camping and squatting, enforce outpatient commitment and civil commitment laws for people with quote unquote serious mental illness or substance use disorder. And they also say HHS has to ensure that discretionary grants from SAMHSA for substance use treatment and recovery don't fund harm reduction or safe consumption efforts. Obviously, that harm reduction piece is important, and the idea that HHS, SAMHSA could use discretionary grants to, in a way that stops funding harm reduction efforts is very concerning, potentially very damaging. HHS has to provide technical assistance to assisted outpatient treatment programs following about civil commitment and assisted outpatient treatment for those who haven't encountered it generally has been used in the mental health world more than SUD, but it is basically a involuntary outpatient commitment that it's a piece of paper that says, here's your treatment regimen, and if you don't comply with it, we can haul you into court and maybe civilly commit you. And Bazelon Center has been opposed to that for many years, does not seem to be supported by evidence. Um, HHS and HUD also have to take steps to end support for housing first policies to the extent permitted by law. That means I think there are a couple of big housing discretionary grant programs like Continuum of Care, 811 programs, supported housing for people with disabilities. those to the extent that the laws say that you have to have a housing first approach, then obviously this executive order could not change that. That's the to the extent permitted by law language. But I think it could impact some of those in a significant way. HUD-VASH, for example, the supportive housing for veterans program. Actually, the statute says that you cannot use a housing first approach, although I think that whole program has been operating under a waiver of that because they recognize that housing first works and housing first is important. And so um, there was a very, very good New York Times article sort of highlighting the impact that this EO could have on HUD-VASH if it was implemented. And I think it may have scared some folks away from maybe doing what otherwise might have been done there. So we'll see. Um, and lastly, just want to highlight HUD has to take steps to require recipients of its funding to increase requirements that people with substance use or psychiatric disabilities use treatment as a condition of the housing. That's sort of the flip of the house, that the don't fund housing first to the extent that is permitted by law is sort of the and increase requirements for taking treatment. And HUD and DOJ are supposed to freeze assistance if recipients are in violation of their programs as appropriate. Again, not a new authority. They already have the authority to do that, but the EO kind of encourages them to use both civil and criminal penalties to do that. And so those are, I think, some of the highlights of the things. I am most concerned about the discretionary grant pieces with respect to housing first and harm reduction efforts. The rest of it, I am skeptical that the Justice Department has good opportunities to try to overturn existing law. I think, by the way, what they mean by the existing judicial precedents is the Supreme Court cases that are about protections for in the civil commitment process. And that is the thing I think they're trying to get rid of because the whole idea here is we're going to sweep, at least the articulated vision is somehow, taking people off the streets and uh, not apparently providing housing, but using civil commitment. And you can't currently use civil commitment to commit people who don't meet commitment standards. And so that's why I think the idea is we'll encourage DOJ to seek reversal of those precedents. But again, I don't think they have opportunities to do that. So I'll stop there. And maybe we can open it up for questions. I don't know if Libby has any further comments on what I
No, I
said.
think Jennifer did a great summary. The only thing that I would add is, a number of people have pointed out that the kind of federal takeover of Washington, D.C. happened kind of right after this. And I will say that the legal authority to do that and to bust up the camps and all this kind of stuff is not the executive order. And I think that's something that, again, has been kind of misconstrued in some of the media. That was not the justification. That is not the legal grounds. So I think that some people, kind of in the media saw this takeover of DC and saw what was happening in DC and, kind of made a connection there that wasn't true. So just kind of pointing that out.
All right. Thank you both. I appreciate yeah, our conversation this week and this has been helpful to me. There is a question in the chat, but we'll go to Shakina. I don't want to say it incorrectly. For which I probably just did. For the first question, if you have a question, there's a little react button at the bottom of your screen that you should see, and just hit the react button and choose raise hand, and we'll put you in the queue to ask a question. And so, um, uh, Shakina, I'm gonna have you say your first name, so that way.
Aaron, you've said it correctly. It's Shakina.
Oh,
I really
okay.
appreciate the landscape conversation. To be able to ask this question I'm in quite a few different intersectional, lots of complications involved with the intersectional of the work that I do in advocacy across America. And so what I'm like wanting to focus on, Jennifer, with what you've presented is a question that's running through my mind because this topic that we're talking on today is very, it's, I've been bringing it up across the nation in different spaces. And it's not something that a lot of folks are aware of or even like participating in. And so I'm concerned from what I've heard from you, Jennifer, is that there could be an opportunity for the administration to put into policy the potential for wording if they figure it out on how to do it in the same way that they've done with gender affirming care for trans rights and other kinds of topics that the administration is using this strategy. I think that for behavioral health, it could be used in the same kind of context as a way to create that lever, that twist, and holds them accountable because none of our healthcare systems want to go backwards in terms of funding. And so they know the model works, they know the strategy works. So although it's an EO right now, if they're able to put into policy a way to hold behavioral health systems accountable, because right now, as you say, it's hard to reach that commitment. But, you know, the administration is not going by science. They're completely ignoring everything that American taxpayer money has spent decades accumulating and has made this country what it is today. You know, they're not wanting to acknowledge that world. They only want to acknowledge the world that they're developing. So I've got big concerns. Public Source this morning just posted here in Pittsburgh, just posted an article in regards to this. There was a gentleman living with HIV who was very clear about his particular situation and where he was finding himself in his behavioral health treatment, as well as recognizing he advocated incredibly well for himself. And at the same time, he knows that the system's broken. He's also aware of the treadmill that he's on with no way out. Housing, treatment, options. You know, one of the things that people aren't considering in this conversation is the amount of impact that just the idea of avoiding civil commitment brings in being involved in those systems.
Great.
Sets people up for failure.
Yeah, no, absolutely. And I mean, I have so many thoughts as you were talking, but I guess first, I mean, it's interesting that you link the administration's efforts on gender affirming care with this in a way, because the one thing that I've seen HUD do thus far to implement the executive orders, they had this NOFO, this notice of funding opportunity for, it's not their big continuum of care grant that they do annually, that's coming, but it was a smaller, the $75 million NOFO for permanent supportive housing. Weirdly, it was just for people with physical disabilities, but they they included some provisions that were supposedly implementing this EO, and one of them is a priority for jurisdictions that there's something about their gender ideology laws or something. So they've got that in there, and then they've also got this in there in a piece, and they have something about priorities for jurisdictions that have involuntary commitment laws. Of course, every jurisdiction has an involuntary commitment law already, so it's kind of like the words are there. But then also something about requiring treatment as a condition of the housing, to the extent that their rule permits it, and their rule actually does not permit it for mental health treatment. It does for SUD. So they have linked these things that sort of, they're I think using opportunities to some extent. But I will say just a couple of things about it. One, I mean, so far the actual specific steps that we've seen have been not that many. Libby talked about the SAMHSA guidance, which seemed really to, you know, not say anything new, really, and to kind of say, oh, this is what we mean by harm reduction, and we don't mean naloxone and other stuff. There's a SAMHSA strategic priorities document, which kind of, again, repeats a lot of the stuff in the executive order, but doesn't say anything specific or new. There is this HUD continuum of care NOFO. That's the most concerning piece I've seen so far. But again, it was small. It was weird because it was targeted at people with physical disabilities. So it's actually targeted not at, for the most part, people who would be impacted by these things. So it's I don't want people to overread it because I have some concern, not just about giving people ideas, but also the states are, you don't want the states to proactively do
Yeah.
things to comply because they think they're going to be disfavored as a jurisdiction and all of these grants. And so, I think it is important for people, to say, I mean, look, this housing first works, harm reduction works. Here's the evidence, here's these things, but not to say necessarily the executive order requires that states do all of these things and that they do sweep people off the streets, or they do stop complying with the ADA, or they do, start committing everybody regardless of whether they meet commitment standards. So I think that's one of my concerns, is just proactive compliance. And
Hmm.
so I think you're right that it's important for people to know about this stuff, but that's my only concern, is like, let's talk about it in the frame of like highlighting what's wrong, but not overstating, what it requires actual jurisdictions to do. Because it doesn't require jurisdictions to do anything until the agencies take particular actions. And so far, they haven't done a whole lot.
Yeah. And I'll just add on to that. I think, Shakina, one thing that uh, uh the one of the things that I said at the onset was that this executive order provides an opportunity for states and municipalities, if they want to curry favor with the president, to kind of proactively start implementing some of these things, which, as Jennifer noted, are actually not required. But the other body that we don't talk about trying to curry favor with the president is Congress, right? Right now, this executive order does not have the power of law, but Congress could change that. So we might see, and I don't want to scare anybody, but we might see, you know, a deluge of bills coming out of Congress that would, implement certain parts of this. Um, and I will say that I see that as an opportunity for advocacy, right? There was nothing we could do to prevent this executive order because it came out of the blue on a Friday afternoon, which was when the Trump administration likes to drop these bombs, right? Um, and so, but if there are bills that are introduced in Congress, then that is the opportunity to form these campaigns and to start advocating and to start educating folks on Capitol Hill. Um, I think you'll see some messaging bills essentially coming out. But, I will point out that right now the federal government is closed, right? We are in shutdown because Congress can't agree. So, at this time of extreme deadlock, is Congress going to be able to pass laws around this? It's doubtful because they can't pass laws for anything right now. Um, so, I just want to kind of frame that yes, that is a real threat, is, Congress making, introducing bills and trying to make inroads to make this executive order law. But Congress is so broken and fragmented right now. Um, you know, I don't want to scare anybody.
Thank you, Shakina Rose, for your question, and both Libby and Jennifer for your responses. We have Don, Alyssa, and Shauna in the queue. And so, Don, we'll take you off of mute here. I know you had a question in the chat, but it sounds like you want to ask out loud too. So, go ahead, Don.
Yeah, thanks, Aaron. Thanks, Libby. Thanks, Jennifer. Great session. I live in a very conservative county. We're Trump voters here. I'm in Andy Harris's congressional district. He chairs the Freedom Caucus. And to make things even more tragic, we have a very conservative sheriff who hopped on, let's round up the immigrants and what have you. My question is, and I'll have a quick follow-up after the answer, I think. Are you seeing any evidence that some local jurisdictions are using the executive order as a justification to go and try to implement this? I I can't tell you how repressive our local situation is here. And I just know that once it gets around to the sheriff's desk, he's going to go. I mean, they hopped on, let's go pick up the immigrants. And I'm afraid they're going to hop on this one. Are you seeing any of this, Libby, Jennifer, Aaron? Thank you. And I do have a follow up if I could, real quickly after.
Yeah, so I have not seen local jurisdictions so far do this, or invoke the executive order, which is not to say it's not happening somewhere, but it hasn't come to me. I have heard folks who are working with states say that states are worried about this and thinking about what they should do. And the people that I have talked to that are in conversation with states, including me, some states have come to me, to say, like, what do you think here? We want to be good. We want to be helpful. I think people have been pretty clear with states that you don't need to, jump through all these hoops proactively. So I don't know. Of course, if you're in Andy Harris's district, I mean, Maryland now has involuntary outpatient commitment for the first time. It was one of the three holdouts for a long time. I live in Maryland also, and it is too bad. One thing, though, that they did put in is people actually have the right to a jury trial before they can be actually outpatient committed, which is interesting, and I'm not sure people know that. But yeah, I haven't. The short answer, the too long answer is I haven't seen it.
I haven't
I
seen it
served on the
either.
board of, thanks, Libby.
Yeah.
I served on the board of the local University of Maryland hospital system. I worked in a residential treatment program. And let me assure you, the emergency department of the hospital does not want to see a busload in the voluntary people committed there.
Exactly.
The $30,000 for 30 days treatment center does not want to see a busload of patients coming in there that don't have Medicaid. And if the sheriff took a moment and figured out he doesn't want a busload of people coming in that he's got to feed, clothe, get medication to for an indefinite level. So I'm only offering this in the sense we may have some unexpected allies around this later.
Yep.
What would the implications of this system be to law enforcement, treatment providers, and hospitals? And I thank you for letting me speak.
Yeah, I will say that actually, like the National Sheriff's Association, the major county sheriff's association have actually been quite good on a lot of these issues. Don, exactly to your point, they can't, it has nothing to do with their kind of philosophy here. This is about budget.
Mhm.
They don't have the budget to do this. The the um, the court systems do not have the capacity. So it's a capacity issue, right? And I think the other thing that I, kind of want to emphasize is that if sheriffs or whoever at the local level decides they want to implement this, they're going to have a myriad of both federal and state and even local laws that they're going to have to go through to be able to make it work. And undoing that is going to take years, if not decades.
Mm,
to undo all of the civil liberties that we have built into our system.
mm,
Um, and I will also say that while I haven't seen any uh, municipalities kind of take this up, I think what I am hearing is that a number of groups that are grant recipients, for example, are changing their name and they're reframing how they talk about these things. I haven't really heard that a lot of groups are going to be changing what they're doing or, the way they're operating. It's the way they talk about it. And I think you're also going to start seeing that documents coming out of the White House are not actually going to change the way we do business, but they're going to change the way they talk about it. Um, they're going to steer clear of the term harm reduction and start using other terminology that, like, what was it? I heard something the other day that was like third pathway of care or something like that. Okay, if that's what you want to call it, then, knock yourself out, you
Well,
know?
same with housing first.
Yeah,
yeah,
like they're calling it different things. It's the same approach, but they're calling it different things. And it's kind of a shell game. It's just smoke and mirrors.
yeah. Thank you, Livy.
Hmm.
I, when I was watching you speak, I was like, it's interesting that when you said harm reduction, you used the air quotes because in the EO, there's air quotes around the words harm reduction, and it's like it's hard
That
to
that bugs me.
understand.
This harm reduction, but
No, I know
that's that
it's
that I
hard
do think
to.
is something we
Yeah,
should discuss. The fact that the executive order puts quotation marks around the term harm reduction. So does the SAMHSA Dear Colleague letter. And there's the National Drug Control Strategy uses the term harm reduction without quotes, but I think we're going to start seeing more of that. And I think it's playful, it's linguistics, essentially. It's just semantics that we're playing here. I would rather keep this in the semantic realm, of course, than the legal realm. But there is, at some level, we just kind of have to
mm.
chuckle.
We've got Alyssa, Shauna, and we have about 15 minutes left, so we'll try to share some time. We have a couple more questions, so go ahead, Alyssa. Ask to unmute, gotcha. Go ahead.
Hi, my name is Alyssa. Not only am I in recovery myself, I also suffer mental health. And just reading this, I just had a question. Well, first of all, I felt like there the education is not there. The recent education is not there. Not all criminals are drug addicts, mental health. And I know what worked for me is ending that stigma that I feel like they're just putting right back into that. And I was just wondering if you felt like, because I feel like it's more of a business, it's more about like, how do I get more money? So I'm very vulnerable in the beginning, right? Now I advocate, but in the beginning, I was very vulnerable. So
Mm.
these treatment centers got a lot of money from me and stuff like that. Is this to you? Do you feel like this is how I get more money? Because I was put in the legal system too. So like, it wasn't because I was really bad. I had a problem. So I paid a lot of fines. I did a lot of outpatient stuff like that. Is to you, is this what's happening again? Like what they're going for?
I mean, I think my own perception is that it's not so much driven by business interests. It's driven by definitely some ideological actors, but not necessarily the industry. And the thing about money in this case is like mainly, who would be doing the involuntary committing is state and local governments, and it is very expensive for them. So in terms of money, it's not a money saver to implement this EO.
Yeah, I think this is going to be a big money loser. And I think that's where we will see more groups, uh, county officials, sheriffs, and folks like that stepping up to speak out against it, because it's going to cost a large amount of money. And state Medicaid isn't going to cover this. Um, so, I mean, I don't know who's going to pay for it.
Yeah. Like I just put in the chat, I was just wondering, like, is this really benefiting us as an individual, like us as the public, or is it benefiting the government?
I
Not
think
benefiting anybody.
it's not benefiting anyone. It is benefiting the White House rhetoric of of, this tough on crime. It's a political messaging bill going into the midterm elections next year. This is so that they can point and say President Trump and the Republican Party is tough on crime.
Mm. Thank you so much, Alyssa, and your Libby for your response, and Jennifer. Shauna, I'm gonna take off mute here. Go ahead, Shauna.
Hello, I'm Shauna. I live in a very small town, and I wanted to comment about how a local judge in my community wrote a Facebook post about the loss of a young man who had cycled through the justice and mental health systems in our community. And the judge wrote also how he felt jail was not the right place for him, but there was also few alternatives. And the judge's story and executive order does show gaps where individuals with severe mental illness or substance use disorder or both cycle through the penal systems, mainly from a lack of resources, not really criminal intent, which I feel this executive order kind of pushes it more back towards that view that we've been trying to shape, that stigma. And I feel like it advocates for expanded institutionalization while restricting harm reduction efforts, which I feel we've come a long way with that. And the judge's case shows how the absence of community-based recovery options uh, and courts often face no choice but to rely on the jail. And I feel like this order may reinforce that those stigmatizations and discriminations, unless we have some evidence-based recovery pathways with it. And I wanted to ask, given these issues, um, how can we ensure recovery rather than warehousing people in crisis? How can we make sure we're doing that, Thank you.
Yeah.
I would say that there are some bills that have been introduced in Congress, which we are really trying to advocate on behalf of, help kind of build the building blocks towards that. There's one called the Peer Support Act, which was introduced by Senator Tim Kaine of Virginia, which would allow Medicaid to support services provided by peer recovery support specialists. I think that is really critical. And I think, when we're talking about the Peer Support Act, one of the things we talk about is how this is a huge money saver. It's a huge money saver for Medicaid, that these peer support specialists are doing tremendous work that, a clinical social worker, uh, you know, would do. But there's other things too, and I think there's kind of in Medicaid where our team is working um, on behalf of the Reentry Act, for example. So for people exiting incarceration, making sure that they have Medicaid 30 days prior to release so that they have a warm handoff to community care. Same thing with the Due Process Continuity of Care Act. This is actually a bill that was introduced by Senator Cassidy of Louisiana, a conservative uh, senator from a very conservative state, is pushing for this bill called the Due Process Act, which would bring Medicaid supported services into jails so that people can get access to treatment from the time that they are arrested. Um, you know, so that folks can break that cycle of incarceration. Um, do I think that jail is the best place for folks? Absolutely not. But the fact is that we have millions of Americans who are cycling through our penal system every day and they're not getting treatment. And so there are real policies that we can link to. Um, and we have advocacy campaigns and we get out there and we keep fighting for them.
Mm. All right, we have two more questions, and we're going to wrap up our lunch and learn. It's H. Wolf on the screen. I forgot your first name. I'm sorry.
That's okay. I don't know why it didn't show up. It's Hannah. But I'll be really quick because I know we're cutting it close. So I work in harm reduction. I work for a county in New Jersey. And while I haven't seen necessarily like the exact effects of the executive order, I have noticed a lot of our population that we work with are unhoused, and a lot of them very obviously sleep in the train stations and at the parks. And it's kind of like everyone kind of knows it. It is what it is. But I mean, like years, they like this is their space. Everyone can anticipate when they get the 6 a.m. train that so and so is going to be where they've always been. And it's been coming up a lot lately that these participants, these people, are getting tickets from the police, like 18 in a month for sleeping outside, being outside. So I guess my question is, and I know it's probably a little loaded, but working in harm reduction, but also for the county, because harm reduction historically is kind of like breaking barriers and doing what you want, and you know what I mean, like kind of finagling it to figure it out. But I can't do that because I work for the county. So how can I advocate? Like what can I do to make that process a little easier while it's all kind of unfolding? Like, do you have any tangible things that we can do as a team to make sure that we're making it less for our people?
Yeah, I mean, I guess for me, really, the advocacy has always, this is not new, right? These issues are not new. We've been advocating for community services, community-based behavioral health services, mental health, SUD services. We have services that work. They're evidence-based. They're quite successful. Most of them are covered already by Medicaid in the mental health space. I think is a little easier, and the SUD space is a little more complicated, but certainly even the peer supports that Libby mentioned, Medicaid already can cover peer support services. That bill would kind of expand it and kind of also put it into statute, but Medicaid has covered it for many years, and actually CMS just made it easier last year to cover those services. So, that those are the answers. I think, it's just it's sort of combating this narrative of, we had this trajectory, we closed institutions, and then everybody became homeless or everybody became incarcerated, and so we need to go back to putting people in institutions, when in fact, yes, we closed many institutions. We also, in fact, increased a lot of other institutionalization, and it's that narrative is false. It oversimplifies many things. The people who were in institutions back in the 1950s were not people like people with dementia, people who would be not in psych hospitals today, but uh, we didn't invest in the community services in Fisherman, and we didn't reinvest the money from the institutions to effective community services. We put it into roads and bridges, and so actually continuing the work of actually developing the community service systems that we didn't create is the answer. And it's sort of a very superficial answer to say, oh, it didn't work, so we need to go back to where we came from. And that's basically what this is doing. So I think the answers are just really, you all are steeped in a lot of the community services that work, and kind of advocating for that, promoting that with legislators, policymakers, et cetera.
Awesome. Thank you, Jennifer. And last but not least, Tom Jackson from Virginia. Sorry I missed you last week, Tom. I was out in Shenandoah
I
Forest.
know you were very close by. I'm sorry I missed you.
I know.
I'll make this really quick because we're right at the end. For those of you who know, and you'll laugh when I say this, I've always considered myself a member of the language police panel. And I would be happy to start working with some other folks, because I have a couple of sources sort of behind the wire, who are doing exactly what you all were talking about, which is suggesting how to rewrite what we've written in a way that will fly. And I'd be happy to do something. Because the second part I was going to say is I just retired from 23 years at the edge of and in the middle of the state mental health system in Virginia, and all of which was centered around people who were, the last 5 years, people who were, none of whom were there voluntarily. But what I found out locally, just talking to my friends and contacts, is in the short run here, nothing's really changing. It's, it is, as a couple of people have said, political crap. And that on the ground, there's still no place to send anybody. And so you can change all the policies you want, but there still has to be a bed someplace to send somebody. And until there is, nothing's changing. That's all I got.
100%. Yep.
Thank you all so much. I'll give Libby and Jennifer give you a minute if in case you want to kind of say anything else. But I just wanted to thank you all for both our experts and our community for coming today. I know that we're living in a time where the people that we care about and the systems that we're working to defend that provide resources to the people that we care about are it's when something like an executive order or state legislation or something in your local city council starts working with, it's like, we get this reactionary, sort of, it's that, we're advocates, we're activists, we're people we're change makers. And so sometimes it's really good to kind of time and be like, how, to really kind of understand what's happening and how it's impacting us. And so this session to me was very helpful. And so I wanted to thank our community for showing up and asking your questions. And so I just wanted to, Libby and Jennifer, did you want to add anything else before we jump off? I want to thank you both. I appreciate your time.
Yep. I just wanted to say before I jump off, because I do have another call, thank you for letting me join. But I'm going to leave you with what I tell my team all the time is that we are sharks. So a shark has to keep moving forward. If they stop moving or if they move backwards, they drown, right? Because they have to have water going through their gills to be able to breathe. And so everyone on this call, you are now all officially sharks. We have to keep moving forward. We cannot go backwards and we cannot stand still. So that's my parting words. And then, but I'm late for my next call. But thank you so much.
Thank you so much, Libby. Jennifer, that's pretty hard to beat for closing words.
Yeah, I know. I know. I was going to say I just heard that shark thing because there was some other animal that actually people were saying always moves forward, and it turns out that it was not correct, but it is correct for sharks. So I can't top that. But anyway, I just happy to be here with all of you, and I think both of our emails are in the chat, and happy for people to reach out if they have any questions. So.
Thank you so much, Shakina, Hannah, Alyssa, Don, Tom. Thank you for your questions, and Shauna too. We'll see you everybody next time. Thank you so much, everybody. Take care of yourself. Appreciate you.